Hello and welcome to Rockingham County 411. I'm Mabel Scott, your Public Information Officer, and today we have another coronavirus COVID-19 update from our Interim Public Health Director, Susan Young. Thank you so much, Susan, for talking to us. People have had questions specifically about our long-term care facilities. Help us out.
All right. So Mabel, I'm going to talk today about our long-term care facilities, which is our nursing homes here within the county. So we have had two facilities, the Bryan Center Health and Rehabilitation Center in Eden and Jacobs Creek Nursing and Rehab Center, that have cases in their residents and their staff, and they have tested positive for COVID-19. So I just wanted to give a little more information about that.
Okay. What about the dashboard that we can see on the websites every day?
All right, so I just want to walk through how you can access that dashboard.
Okay.
To access, you type in your search bar covid19.ncdhhs.gov/dashboard. And you will see a native panel to the right of that screen. Click on the outbreaks and clusters. Then you will see what it says COVID-19 ongoing outbreaks and clusters in congregate living setting report. And I do have that printed off so you can see that, but that is what that page will look like. And what you need to do is you will need to click on this link here, and that will bring up actually information about our county and about our outbreaks at the county level.
And this information is updated every Tuesday and Friday?
Yes, at 4 p.m. And who updates this information is the Department of Health and Human Services.
Okay.
And all other times you can of course visit our website at Public Health, where we have all our COVID information and our informatics page.
Good, good. And you put this information out there for citizens and constituents to see.
Yes, ma'am. So everybody will have all the information in an up-to-date, timely fashion, and that we can get that information out to you. We want to be totally transparent with what's happening in the county, and so you can have up-to-date information.
Okay. Also, you had said something about patient census information.
Yes, and the patient census information, these numbers change daily due to transfers, placements, hospitalizations, and even deaths. So the patient census information for these long-term care facilities, you're going to have to contact the facility directly, because we don't always have that up-to-date information about the facility census.
Okay. What about residents that are hospitalized?
Both facilities currently have residents that are hospitalized at our local hospitals, and they also may be transferred out to different hospitals outside the county.
Okay.
But currently we're unaware of any staff that is currently hospitalized from those long-term care facilities. Right now we only know of residents.
Okay, all right. And the people who passed on, who lived in Rockingham County, they had underlying health conditions?
Yes, ma'am. So everyone here so far that has passed away in Rockingham County has had some sort of underlying health condition.
Okay.
Every single one. So we do know that. And the age ranges for our deaths are from 56 to 98. So that is a wide age range, but specific information on death data, I just don't feel like I can report to respect the families and their loved ones. Death certificate data is the only source that records specific death data here within the county.
Okay, okay. We go back again every time we talk to you, contact tracing, and we see so many news stories about that.
Right, and we are still performing contact tracing of our positive COVID cases here of county citizens. All the long-term care facility residents are going to be contact traced, and basically the only contacts they have is other residents and the staff there in the facility and administration, because of course, you know, the long-term care facilities have not allowed visitors in for quite some time now. So the only people coming in and out of those agencies is the staff and the fellow residents there.
Okay, and with contact tracing, what you do is try to find out who was in contact with the person
Yes,
who ended up testing positive.
Yes, and at the long-term care facilities, we have contact traced all staff and the positive cases and have isolated and quarantined those individuals per DHS guidance. And we actually have isolated their first point of entry of COVID into both of our long-term care facilities. And of course it was through staff, and we did that by interviews and laboratory testing, but we are aware and we have taken care to isolate those people and their household contacts.
For months and months and months, as we have done these interviews, we have heard about other counties where we were seeing a real uptick in people testing positive with COVID-19. And in Rockingham County, for many, many months, we're not seeing that.
And I'm so proud of those statistics, Mabel. It just goes to show our county working together as a whole. And please note, for the over 6 months, our long-term care facilities did not have any cases.
Yes.
The health department and the county worked diligently to keep this virus out of our nursing home and out of our, around our residents. And this is a true statement for the dedication and hard work of all the staff and the leadership at those facilities and the workers themselves to try to be as vigilant as possible. Of course, it's inevitable with the increased community spread of COVID and our increase in the community that eventually we can't keep it out of any selected population. It's going to infiltrate every population, and that included the nursing homes. And we were sad, we were very disappointed when we got our first case, but we tried to move very quickly to make sure they had the resources they needed, the PPE to help with staffing, to put them in contact with state contacts, whatever they needed to be assured that the residents and the staff and the administration were getting the support that they needed.
And our long-term care facilities are really focused on doing the very best that they can for the seniors and the patients who are there.
Yes, they are very dedicated. It's taken collaboration and compassion, and the care is evident in both of these facilities about how much they really care about those residents and providing the best care that they possibly can, even in a terrible situation, which is a crisis situation that they're in.
And we always talk about this. Come on, what do we do?
We wear a mask.
Okay.
Here we go. We wait 6 feet apart.
Here
we
we
wash
go.
our hands and do not attend large gatherings and do as many outside activities as possible and decrease your indoor activities. This limits the spread of the virus.
And data disclaimer, because when information is out on Facebook and social media, sometimes there are so many questions asking about the numbers, and we want people to understand things change so quickly.
Absolutely. It's an ever-changing, it changes hour by hour in our workflow and in our workloads. And we try to put that information out as accurately and timely as possible. And it may not be always reported to us in a timely and accurate manner. So we do the very best that we can to report that information accurately and timely. And I will just say that currently, as of today, we have 67 confirmed cases from the long-term care facilities. Now, that is not what's going to be reported on the DHH website, because of course it's not updated as frequently as we are getting that updated information. And we are very diligent in trying to be transparent about what is occurring.
We want to again thank our interim public health director, Susan Young, and her entire team for all of the hard work that you all do, for the long nights and the weekends and the holidays, and everybody here is just working because we're our essential workers, and this is our job to support the welfare and the health of the people here in Rockingham County. Thank you for all that you do. We are going to wear our masks, wait 6 feet apart, and wash our hands and sing that birthday song. And please keep all the people in Rockingham County in your thoughts and prayers as we look forward to a vaccine to take care of this, oh boy, this evil virus that has just attacked the whole world. We're praying for a vaccine.
And hopefully it's on the horizon. Everybody keep their ears peeled to the latest information about vaccine and how soon that it will be here, and we will definitely be distributing that vaccine just as soon as we can possibly get it.
Thank you again, Susan Young, for being with us and sharing a COVID-19 update.